How to start an IV correctly? Welcome to a comprehensive video on IV insertion, an essential skill in the healthcare field. We'll break down this complex procedure into simple, easy-to-follow steps. From hygiene to the tools and the actual process, we've got you covered. So, whether you're a seasoned healthcare professional or student, this video is designed to describe the process of IV insertion. By the end of this video, you will have a clear understanding of how to start an IV. Before we dive into the steps, hygiene is an absolute must. It's the cornerstone of any medical procedure, and IV insertion is no different. Keeping your hands clean and wearing gloves are critical first steps. But we don't stop there, do we? No. We ensure the insertion site is also clean. Using an alcohol swab to wipe the area is a simple but crucial step. It minimizes the risk of infection and provides a safe environment for the procedure. Remember, cleanliness is the very first step in starting an IV. Now, let's familiarize ourselves with the tools we need. First on our list is the catheter, which is essentially a thin, flexible tube. It's the main player in IV insertion, as it's responsible for ensuring the fluids or medication reach the patient's bloodstream. Second, we have the tourniquet, which helps to make the veins more visible and accessible by slowing down the blood flow when wrapped around the patient's arm. Third, we have the dressing. This is your all-important protective barrier. It keeps the insertion site clean and safe from potential infections. Other supplies include gloves for protecting both you and your patient, an alcohol pad for sterilization, and a syringe for drawing up and giving the medication. With these tools in hand, you're ready to start an IV. Remember, each tool plays a crucial role in ensuring a successful IV insertion. With hygiene and tools out of the way, we can now dive into the actual process. When it comes to intravenous or IV insertion, the first step is to apply the tourniquet. This will make the veins more prominent and easier to access. Wrap the tourniquet around the patient's arm about 3 to 4 inches above the intended insertion site. The tourniquet should be tight enough to restrict venous blood flow, but not so tight as to cut off arterial blood flow. Next, we move on to vein selection. With the tourniquet in place, the veins should appear more visible and palpable. The median cubital vein in the antecubital fossa is generally the first choice due to its accessibility and size. However, if this vein is unavailable or unsuitable, you can opt for other superficial veins in the forearm or hand. Once you've selected the vein, it's time to insert the catheter. Hold the IV needle at a 15 to 30 degree angle with the bevel up. Pierce the skin and vein in one smooth motion. You'll know you've hit the vein when you see a small amount of blood, known as a flashback, in the catheter hub. At this point, lower the angle of the needle and advance it slightly further into the vein before sliding the catheter along the needle and into the vein. With the catheter in place, you can now remove the tourniquet and the needle, leaving the catheter behind. Be sure to dispose of the needle in a sharps container to prevent needle stick injuries. Finally, secure the dressing. Clean the site around the catheter with an antiseptic, then apply a sterile dressing. This not only helps to prevent infection, but also keeps the catheter in place. Remember, practice makes perfect. The more you perform IV insertions, the more comfortable and proficient you'll become. That's it! You've successfully started an IV. If you found this video helpful, please like and subscribe. Click on the next video showing the step-by-step tutorial of insertion of the IV.